Hey everybody, this is Rob, and this is episode 13, lucky 13, of my podcast for the recently diagnosed. In case you hadn't noticed, the logo for this is based on the podcast. Podcast. This is the logo for this podcast is based on the handbook for the recently deceased, which is from Beetlejuice. Pretty excited for the new Beetlejuice movie to come out. I don't know that it can possibly measure up to the first one, but hey, who knows? I don't know. But something I always forget to say is look down there. There's a button that says subscribe, or maybe it's over there. I don't know where it is. It's YouTube. YouTube seems to change all the time. So like and subscribe if that interests you. And on with the exciting episode 13. It's scary stuff, kids. So episode 13, I wanted to talk about kind of updates on general information on my progress or lack of progress. I don't know. The disease is making some progress, which is not good. Especially I seem to be seeing a little bit more tremoring going on. More in my right hand, which used to be my more dependable hand for eating and that sort of thing. But it's kind of on and off. I talked to my doctor about it, my movement specialist, the other day, and she suggested I raise my rate for the Sinemet that I'm taking, my carbidopa-levodopa medicine, which I take 3 times a day. She suggested instead of 1 pill 3 times a day, I take 1.5 pills 3 times a day. So I did that for a little while, and I was thinking, is this all in my head? But it seems like I'm shaking even more since I upped the dosage. And I talked to Deb, my wife, and she confirmed that she also thought I was shaking more. So I backed away, and now I'm just taking 1 3 times a day again. And the tremoring seems to have backed away some, and my shaking is not as bad as it was a week ago. So who knows what. The other information, which all kind of ties in at the same time, is with the trial that I'm taking for the Parkinson's medication, not the carbidopa-levodopa Sinemet, but actually the drug trial that I'm on through the Fox Foundation, and I can't remember the name of the drug company, actually, it's supplying drugs. I am out of the blind phase of that, the double-blind study, although I don't know whether I was on the actual medication or whether I was in the placebo group. Either one, I don't know. Or there also was a mid-range, so it was like a third were on the placebo, a third were on the mid-range, and a third were on the full dosage. I've transitioned for the next 3 years. I am on the full dosage. So that's kind of interesting, but I went to the full dosage of the real medication for the drug trial at the same time that I went to 1.5 pills per day. So, you know, who knows exactly what impacted me that made me shake even more. Pretty sure it was the Sinemet, because backing away from that seems to have reduced the amount of tremor that I have. To some degree, anyway. The other thing is that other news is I switched over from private insurance to using the VA for my health coverage, and that is because I had to retire because Parkinson's disease was impacting my work. So the transition to the VA has been awesome. I go to the Ralph H. Johnson VA hospital here in Charleston, and also there's a clinic in North Charleston that I go to, and both of them have been excellent. I've been to set up initial consultations with new providers, general practitioner sort of thing. I got a PA that's up at the North Charleston facility, which is awesome. She's great. And I went to see a urologist in regards to my follow-up on my prostate cancer, which I have news on that as well. And then I went to see a movement specialist. So they are not a PODREC, which is the military Parkinson's specialty clinics, which there are 7 across the country, not one in Charleston, but they are an associated facility or whatever. So they also work with the official movement disorder facility at the Medical University of South Carolina, which is where I'm going for the trial. And I went to see a doctor there, Dr. Cooper, and also Dr. K. Dr. K has a really long name that is, I can't even pronounce, and he said, just call me Dr. K. So that's what I'm calling him. Dr. K was like I want to say resident. I don't think he was a resident, but the actual attending physician that I went to was Dr. Cooper, and she said that my doctor from the clinical trial, one of my doctors from there, also works at the VA. So in the future, I'm going to be seeing a doctor, the same doctor, at a couple different locations. So that's good because she's familiar with my progress, and I've been seeing her for a couple of years. Can't remember her name. That's, maybe part of the Parkinson's, or just I'm old and sometimes you just forget names. So I'll probably remember before the end of this podcast, but maybe not. So the next topic I wanted to cover real quick was the follow-up that I had for my prostate cancer, which my initial PSA level, which is the prostate blah blah blah, I don't know what PSA stands for, but it's a blood test that I got for my 60th birthday, which showed that my PSA was like 8.5, and that's way out of the normal range. Normal range should be below 4 for somebody my age. So I got the biopsy test to confirm that I had prostate cancer. I got a spacer inserted, which is to help protect organs while they do the radiation treatment. That's how I designate, or this is radiation treatment. But I got that done. Then I had 5 rounds of radiation at MUSC with Dr. Lally, and then my first post-radiation PSA test was at like 4.5 something or whatever, so still slightly out of range. When I went for the follow-up to talk to the doctor about that, he said it should just continue to go down. My next one, which I got done like a month and a half ago or something, was at 2.5, so I'm way within the normal range now. So I won't say I beat cancer. Maybe I beat cancer on this particular thing. Luckily, it was discovered pretty early. It was still stage 1 cancer. And the doctor said when I had my latest follow-up, because the follow-ups are like every 3 months or something. My latest follow-up, the number, he was like, it should just continue to drop. A buddy of mine got radiation treatment for prostate cancer, and he said his PSA score is like 0.3 or something, which is, pretty much no prostate is left because of all the damage. So this has probably been, it's not an extremely long podcast so far, so I'm going to just talk a little bit about some of the tools that I've used in compensating for my shake. And one of the things I noticed was I was knocking over cups fairly often, anyway, more than once a week. And a lot of cups that you see, glasses and whatever, they are shaped like basically an upside down pyramid where the base of it is really small. So the cup is shaped like this, and it's easy to tip it over. So what I did was I got a new coffee mug, and if you notice, it's got the opposite shape. It's much bigger around on the base, so it isn't way less likely to fall over. The other thing is, if it does fall over, it's made out of stainless steel, so it can't break. And on top of that, it has like this rubber ring around the base, so it really kind of has a little bit of grip action, so it's even less likely to get knocked over. And a bonus, I don't know how well you can see this, but the bonus is it has a bottle opener in the bottom. So if I want to drink, say, beer, if I would drink a beer, which sometimes I drink beer, I like beer. If I get a bottle of beer, you can open that in the bottom. So that's one way of compensating for things. Another compensation, pardon me, but make a bunch of noise, is I got these nifty pieces of silverware which are designed for Parkinson's people. And if you can see, super heavy duty. So that was the knife. You know, it's basically the same thing. There's the fork. Very heavy, very heavy. These are like, I would say, easily 6 times as heavy as a normal. And then spoon. But if you notice the spoon, it's practically a soup spoon big. So if I'm eating stuff, it's less likely to fall off. So there are some ways that I am compensating for the shake that's going on. Still have a, you know, some challenge with drinking. I found that I'm using a straw a lot more, which a lot of times there's issues with swallowing. It's a known symptom of Parkinson's. I don't have that issue at all. So sometimes there'll be instructions not to use straws, but I use a straw. It seems to work pretty well. And then when I was watching Still, which is the Michael Jackson, not Michael Jackson, the Michael J. Fox movie about his Parkinson's, a few times he's drinking and he uses a straw. So, you know, straws are not forbidden. I use plastic straw, but a solid, very solid plastic straw. It's not a disposable plastic straw because, hey, save the environment. Although from what I've read, the plastic straw issue is mostly a made up thing to make people feel better about what they do. Anyhow, so I kind of moved in a few different directions on this. I would say, you know, yeah, a lot of different directions on this. So this is podcast 13. And like I said, if you like this, please follow the channel and give the video a thumbs up. Comments on YouTube are definitely appreciated, as are questions. I can address things in future videos if you have questions about anything I've talked about so far, general Parkinson's questions, or whatever. So that's it. Thanks. Have a great day.